Hi, I'm Kersi Chavda. I'm a consultant psychiatrist at 3 corporate hospitals in Mumbai, and I have a private practice of my own. A large number of my patients and friends and clients they belong to the LGBT community. So what I'm going to do is talk a little bit about the kind of travails that they might face in a place like India. Now we know that being homosexual is actually considered to be a crime in our country, and because of that we do see a lot of changes that have occurred in people who have this kind of a problem, probably related to the fact that they find it very difficult to come out, in a sense, to people, and also because they are scared of the legal implications and the police reactions if they're ever caught doing what they want to do. What are the things that we normally see? Probably the most important thing is the difficulty in coming out to the parents and coming out to society, because it's still considered to be something that's very different, very wrong, etc. Very often parents get into this thing of what will society say, what will people do, you can't be like that, let's get out of it, and so on. Very often they're pushed into getting married, even though they have absolutely no attraction towards the opposite sex. And because they find it difficult to refuse, not only do they kind of get into a marriage which they have no interest for, but they also land up ruining somebody else's life. It's very difficult for a youngster who anyway has problems in finding out what kind of sexual orientation he has to reconcile with the fact that he might actually be having sexual orientation towards the same sex. In a lot of schools, sex education takes place. Very few schools really talk about homosexuality or bisexuality. So with a young guy who's 13, 14, 15, with raging hormones, for him to cope with the fact that he might actually be different from his peers is very, very difficult. And he's not sure, and he can't really discuss it very often with anybody, or he feels too diffident about it. So it festers in him and he really doesn't know what to do. We must realize over here that homosexuality is not a crime. I mean, we don't believe it, and in psychiatry we don't even consider it to be any more a disorder or a disease. It's considered to be a variant, and variants are okay. It's considered to be normal. It's considered that there are actual changes that happen in a person's brain because of which he lands up being oriented towards a particular sex. So it's not considered to be a disease. It's certainly not considered to be something that you have to try to change. At one time we used to talk about a person being comfortable with his orientation and somebody else not being so comfortable, and an attempt being made to change orientations. But today I think that kind of proposition has been absolutely disregarded. So at least in psychiatry we don't consider it to be a crime or a disorder. All we try to do is make the person more comfortable with whatever he's feeling, and make the family more comfortable with whatever their son is feeling as well, or daughter is feeling as well. When a person is gay, there are often other things that he looks at. It's difficult at times to set up a house with somebody and to set up maybe even a permanent relationship with somebody in terms of a marriage. That's very, very far away in India because we see the problems that they are facing. So especially for the older person who would like to be in a kind of permanent relationship and like to revel in it and be with that person, it becomes very difficult to set up in a flat. The normal kind of concessions or the normal kind of things that are given to a spouse may not be made available if you're the same sex person, which has its own repercussions on a couple. Families today are becoming a little more supportive, but there's still an enormous amount of pain that they also go through when they go through this, when they come to know that their son or daughter is having a same-sex orientation, and this desire that they change by going out with the opposite sex, or try this one, try going out with this one, or try going out with that one, or eat this food, or go to this doctor, still persists, especially in the uneducated, but also in people who have very good education. There are a number of doctors also who feel a little uncomfortable dealing with this situation. and would find it difficult to provide the right kind of counseling services that maybe the person would need in order to cope with whatever is happening to him. Taking all this into account, what are the things that we should actually be doing? I think what we need to do is to be aware of the fact that this is normal and that we don't have to get into some kind of a frenzy if we know that our son or daughter or brother or sister or whoever, our friend comes out and says that he's having this kind of orientation. One doesn't have to necessarily think that you've been in the company of a deviant or you've been in a company of somebody who's going to harm you. If nothing at all, by and large, they're just absolutely normal people, just like you and I. They have a slightly different orientation, which means nothing at all. And they have the right to live together happily, just like we have the right to live together happily as well. I think what we need to do is to aim to make our society as stigma-free as is possible, so that just about everybody who lives on it is a happy person. There are other issues as well. It's very difficult for a person to come out, and even before he comes out, there's an enormous amount of confusion as to what his own sexuality is all about. I'm saying his, it could be her. So you have guys who really don't know what to feel about themselves. Nowadays, in schools where sex education occurs, it's extremely difficult for a person to kind of identify with what is being taught about the opposite sex. He identifies more with the same sex, and he finds it extremely difficult then to reconcile to the fact that he may or may not be just like his peers. Occasionally there are certain mannerisms that come in the way, and given the kind of bullying that happens, we see a lot of negativity amongst the kids of today. In addition to that, you also get this whole thing of, am I normal? Is there something wrong with me? Can I do something to become normal again? And a lot of people would not be in a position to discuss this with their own parents, which increases their feelings of alienation. Very often it's difficult for them to discuss it with the doctor as well, because they're not really going to be in a position to ask their parents to leave the room, and then they can't discuss their problems with the doctor in front of their parents. There's this whole thing of promiscuity and free sex and stuff like that. This whole thing of sexually transmitted diseases that may or may not be associated with a particular kind of sexuality, which kind of aggravates everything that is happening. And you have myths. You have myths that the person who has a particular sexual orientation is going to be raping everybody, is going to be jumping on people of the same sex, which is all hogwash and which really should not merit any kind of consideration. Unfortunately, occasionally, even the kind of caricatures of homosexuality or bisexuality that are shown on screen perpetuate the myths. Homophobia, homophobic jokes are legion, and it's not then surprising that a person who has this kind of issue would find it very difficult to